For a long, long time, the main weapon against the kind of severe, chronic pain you get from autoimmune diseases was an opioid. But that whole story is changing, and it's changing fast. Today, we're going to break down a huge shift in medicine that's basically rewriting the rulebook for millions of people.
Just think about it for a second. If you were dealing with pain that just wouldn't quit, this debilitating, everyday pain, what's the first thing you'd think of? For decades, for so many people, the answer started with a prescription pad.
But here's the thing. For people with conditions like rheumatoid arthritis or lupus, that old answer is just not the go-to anymore. The entire playbook for managing their pain is being torn up and rewritten, and we're going to show you exactly what those new pages look like.
Okay, let's dive right in. This story really kicks off with a massive study. We're talking over 140,000 patients that found this one single moment in time, a really dramatic turning point in how doctors started to think about pain.
This timeline really tells you everything you need to know. Back in 2008, you see that opioids were a pretty common first move, but then look at 2014. That's the pivotal year. The DEA, responding to the national opioid crisis, reclassified hydrocodone, which made it a whole lot harder to prescribe. And that one decision right there changed everything.
So let's zoom in on what was happening before that big policy change. Between 2008 and 2014, the trend was just undeniable. For patients who are just getting diagnosed with an autoimmune disease affecting their joints, the rate of opioid prescriptions was just climbing and climbing. It went from 26% all the way up to a peak of 38%.
And then the reversal. After hitting that peak in 2014, the trend doesn't just flatten out, it completely nosedives. The rate of opioid prescriptions for these newly diagnosed patients just plummeted, dropping from that 38% high all the way down to 24% by 2020.
So just how fast was this shift? Well, after 2014, the odds of a new patient getting an opioid prescription dropped by 15% every single year. I mean, that kind of rapid, consistent change in how medicine is practiced nationwide, it's absolutely staggering.
Now, this didn't just happen in a vacuum, right? As doctors started moving away from opioids and even common anti-inflammatories, they had to turn to other tools, and they did. We saw more physical therapy being used, and also more anticonvulsants. Those are meds originally made for seizures that also turn out to be great for nerve pain. The entire pain management toolkit was being rebalanced, right in front of our eyes.
So, if doctors are using fewer opioids, what exactly are they fighting against? To really get the stakes here, we need to look inside a specific disease. Let's take rheumatoid arthritis as our example to see just how complicated this battle really is.
First thing to know, this is not your grandma's arthritis. It's not just wear and tear. Rheumatoid arthritis, or RA, is a systemic autoimmune disease. And what that means is the body's own defense system gets confused, and it starts launching this all-out attack on its own tissues.
The key players in this mistaken identity attack are these things called autoantibodies. You can basically think of them as soldiers who've started firing on their own side. They're the little markers of this internal friendly fire that defines the disease.
And here is the craziest, most challenging part of all. This whole process, it starts in complete silence. Research shows that these little friendly fire markers, the autoantibodies, can be found in a person's blood a median of 4.5 years before they even feel the first twinge of pain. The immune system is already going haywire long before the pain and swelling show up.
So if the problem starts with the body's own systems going haywire, could the solution also come from within? This is where the research gets really fascinating. Scientists are exploring a brand new target, the body's own internal control system.
And this is the big question, right? The one driving all this new research. Is there a switch somewhere inside of us that we can learn how to flip? A way to just turn down the dial on all that runaway inflammation?
A lot of scientists think the answer might be in what's called the Endocannabinoid System. Now, this is a huge network of signals and receptors all through your body that's basically like an internal regulator, always trying to keep things in balance, a state called homeostasis.
Okay, and this is the absolutely crucial part. This system has two main kinds of receptors. You've got CB1 receptors, which are mostly in the brain, and those are the ones responsible for the psychoactive effects people associate with cannabis. But CB2 receptors are totally different. They're mostly found on our immune cells, and activating them doesn't cause any psychoactive effects. Their main job seems to be directly regulating inflammation.
Just look at what could happen. This table shows what happens when scientists can activate those CB2 receptors on the exact cells that are driving RA. The effect is targeted, and it's powerful. It can tell the aggressive joint lining cells to stop growing. It slows down the cells that destroy bone, and it calms down the overactive immune cells. It's like sending in a master negotiator to get everyone to chill out and restore balance.
So, we've seen this massive shift away from opioids in the real world, and at the same time, we've got this incredibly promising new frontier in the lab. But what are the big unanswered questions? Where do we go from here?
Well, the researchers who found this trend, they laid out a pretty clear roadmap. First, the clinical guidelines, the official rulebooks. Some of them are a decade old. They have to catch up to what's actually happening. Second, we have to really study if these new ways of treating pain are actually better. And maybe most importantly, we need to answer the biggest question of all: how is this huge shift affecting patients' actual lives?
And that really leaves us with the final, most important question. And it's summed up perfectly by the study's authors here. The data shows without a doubt that what's being prescribed has changed. But the human impact, that's still an open question. Are people's lives better? Are they more functional? Are they in less pain? That's the part of the story that still needs to be told.